we'll just allow a little bit of time for everybody to join us, another minute or two. And I am on vacation right now. Because of the last 10 days, I'd call it very much a work vacation because almost every day I have been involved with showing somebody the light technology over here and helping some people with pain. As a matter of fact, we had our helmet here to deliver it to one of our helmets to deliver it to a chiropractor in Florida. And in the process, there was a young boy who had a concussion, and we were able to use the light on his head. Well, one treatment, he was told us he wasn't able to think clearly, that he had difficulty just even looking at things. And he did the one treatment and he said, wow, I can see, I can think clearly right now. So, all right, I think we'll get the webinar underway. So I want to welcome everybody tonight. We have a special guest by the name of Dr. Laurene Duke. She has a practice in California, and she'll tell you a little bit about it in a few minutes here. But tonight's special meeting will be about pets and the use of light for pets and how you can improve their situation by using photobiomodulation. Also, the one fellow that we were going to have has a fantastic story, Mr. Alan Crow. Unfortunately, he had a motorcycle accident today, and he's in the hospital with lots of scrapes and bruises, and well, he won't be able to join us from the hospital, but he did say he's going to take pictures and show the improvements on the places where he lost some skin and bruises and other things. So you'll be taking daily shots as to the improvements that he's seeing using his photobiomodulation light. But in his case, he had a cat, and I'll just mention this right up front. So before I get there, just want to mention everybody who's joined us tonight will be able to be entered into a ballot. Ballot will be entered on their behalf for staying to the end of this program and watching our webinar. And at the end of this month of April, we'll do another draw. And every time you watch us for the next couple Tuesdays, your ballot will be entered each time you join us. So we'll be doing that draw at the end of the month, or beginning of, at the end of the month, really. Anyways, again, thank you for joining us from all over. We have guests that wanted to be in on tonight, but the one fellow's in Sweden, and it's pretty early in the morning right now for him. So he won't be joining us, but we have had people from Malaysia, Australia, and tonight I believe we have from Alaska, Hawaii, different parts of the US, different parts of Canada, and into South America as well. So, well, thank you everyone for joining us, and here we go. So I want to tell just the first story right off the bat. So the fellow Alan Crow, who is going to speak tonight about his cat was older, 15 years old, and it used to prowl the neighborhood, and then would go throughout the house, but no longer go out in the neighborhood. And then as it got older, it ended up having pain in that, and so it was down to one room in the house, and it wouldn't go into any other rooms or go down in the basement or up the stairs. He started using the panel light. That's the one that's about there we go, about a foot square. How's that? Everything's a little backwards when you're trying to do this. So anyways, foot square. So first time he turned on the light, the cat wasn't too excited about the light being on, and he tried to encourage the cat to be under the light. Second time, it was a little less effort. Third time, he turned on the light, and the cat came under the light. And by after that, as soon as he turned on the light, the cat would leave its comfy bed to lay on a hardwood floor and get the light treatment. And as he did that, he noticed that the cat started now going through the house, and then it started doing the stairs, up and down the stairs. And not only doing that, then started even going out and prowling the neighborhood. So that's how confident the cat was able to get, because it now was able to move and move well. And he did say one funny thing was that that when he would reach over to turn off the light, the cat would actually snarl at him. So anyways, I want to now bring on Dr. Laurene Duke from California. Dr. Duke, if you could turn on your video. There we go. There we go. So Dr. Duke, can you tell us a little bit about, first of all, where's your practice exactly?
I practice in Bellflower, California, which is near Long Beach.
Okay.
Sunny today, so it's beautiful out. And I'm a general dentist. I've been doing it for a long time. I've had laser since 2017. I totally believe in photobiomodulation therapy. It has done wonders in many ways for me, my family, my patients, and my friends.
And what are some of the things that you've seen with your patients? Just we'll talk about the human patients for now.
We have seen bone when the tissue is can't even think of the name right now, but the tissue is off the bone and the bone is exposed, like in the lower jaw, and not osteoarthritis necrosis, but kind of like that, just a damage, and it wouldn't heal for weeks. And now we put photobiomodulation therapy on it for like 2 weeks, and it all heals. I've had somebody that's in the mouth. We use it to heal sores around the lips, denture sores. We use it for just a lot of things. We'll put it on the lymph nodes and help people that are sick, and just help it drain. People have fallen down on their face. Oh, people have fallen down on their face. And we have big black and blue. We stick it on there. I have been able to, I forgot, I didn't even write this down. A patient fell flat on her face, and she had a mouth guard that I'd made her, demolished all of her front teeth. We couldn't see them when she first came in. We stuck her guard in. We found her teeth. I used my laser, my photobiomodulation light on it every other day for 6 weeks. Everything healed with no scarring. She did not need to get her jaw wired. All the bones broke in the maxilla. Ultimately, we discovered number 11 over here. Number 11 broke in the middle of the root, apex, never had any issues. She lived for like 7 years after that. And then she just recently died. But all those teeth were vital. Everything was wonderful because we used light therapy and we used the guard. It was amazing. I forgot about that. So we've used that on her. Somebody's fallen down and hit a front tooth with a wrench, or fallen down, and we have put your little light,
the probe
intraoral tip on the gums and on the tooth, and the tooth has not gotten dark, and the tingling sensation disappeared. We have had a lot of good results with that.
Thank you.
Yeah, lots with the mouth. And go ahead.
Yeah, so as a matter of fact, I did a face plant into concrete. I fell face forward, and boy, did I really hurt myself. I lost my front tooth in the process. Well, and the speed of healing from the amount of injury that I had on the front face. Now, I didn't actually have any x-ray or whatever, but there was an x-ray that was just done, and it shows that there's there was probably a couple bone breaks that I had in my upper area here, but I didn't know it. But it all healed up very well, and
It just heals. It just
yeah.
heals beautifully. It just does a great job. I
And
broke
my daughter, her daughter, my granddaughter, went and fell, and the whole area was all really bad looking above the gum, and she immediately used the light, and a color all came back properly in amongst above the tooth, and the tooth was very, very, very loose. You know, it was she was young. I guess she'd be about 5. She so didn't lose the teeth, and about a week later, she hit the same teeth again with something else, and she ran away, used the light, and the teeth have been able to make it through 2 traumas.
and I have a grandson who was 4. He had to have his tonsils out. And so when he got his tonsils out, it was painful. And he had the red light, he had the SPP, the SunPower Plus. He wouldn't open his mouth because he was kind of a little scared of it. And then so he put it on his back, on his behind his neck, cervicals. And you know, that quenched his pain. He didn't have to have all the medicine that was able for him. And he would put it on there 2 or 3 times a day and just sit there on the recliner with it behind his neck. And now every time he falls down, hurts himself, he gets your red light and sticks it all over him.
Yeah.
And he just knows to do it.
All my kids, they had the wisdom teeth extraction. All of them have had used the light, and so have their mates when they had their wisdom, and no painkillers.
Right. That's the way it was with his tonsillectomy. He was fine. He just, when it hurt, he knew to just run and put it on the back of his neck. Eventually, we got him to open his mouth, but he hadn't had it long enough to get used to it. Now, when he falls down, he just goes and puts it on himself. He fell down on his forehead. He just stuck it on, my son said a couple weeks ago. So yeah, they're very good with using it. So that's another oral reason, is for tonsillectomies. And we have many patients come in and use it before or after their oral surgery or tonsillectomy. We have people come in all the time, and I treat one trigeminal person with it.
Right.
That's been eye-opening to treat trigeminal neuralgia. But my staff has treated their dogs. I haven't had a need to treat my dogs, but they have treated their dogs.
So tell me about that. Tell me about the animals, because now we'll
Okay.
transition.
You have the video of one that maybe you can play later. I don't know if you want to play
Yeah,
it.
we're going to play that in a few minutes after
Okay, fine.
your.
I'll tell you a little bit about it. So the one that you're going to see is my assistant. She had a big dog, and he had happy tooth syndrome, and he was banging his thing. So she spent a long time going to doctors, a lot of money, and then she finally said, I'm going to take the SPP. We call it the SPP, the white one, the little palm unit.
Okay.
And so we call it the SPP because I have to abbreviate it somehow in my notes. So she came and got that and took it home, and within 2 days, she knew there was a difference. And she'll tell you all about it.
1 second here. Jim, do you think you can find that picture and pop it up if you can on a share screen if it works? We'll try that. In the meantime, we'll talk about some of the stuff that you're continue. So we'll show
and so I have used photobiomodulation therapy a lot. She uses it on patients, but she'd never really used it on herself, on her family, or herself, or her dogs. So when it wasn't working conventionally, she sheepishly says, "Can I borrow it?" I go, "Yes, take it home. It's okay." So she took it home and she used it for about 2 weeks, and it was fully healed, and it's never come a problem again. And she'll tell you in her own words. It's really well done, I thought. And then my other employee is a hygienist who does German Shepherd rescue. And I wanted her to speak because she's got tons of knowledge, but she was unable to figure out what to do. So anyway, she borrowed my photobiomodulation unit and took it home and used it on a dog that was older, that couldn't walk anymore, couldn't get up to go to the bathroom, just wasn't able, but she still thought it had some spunk in him. So she used it on him. And you know, that dog got up and was able to go to the bathroom outside for another 6 months. And that made her really happy. Another one of her dogs was a big shepherd and was the love of her life. And she goes, I'm not ready to put him down yet. So she used it. He couldn't walk anymore or jump in the back of the pickup to be taken places. And so she started using the light on his spine, and she just kept it up, used it on his spine. And in about a week, he was able to walk. And in about a month, he could leap up in the truck. And he did very well for another almost a year of doing that. And she used to borrow it, once or twice a month from me. And then she'd use it on him. And she says it just kept him going and he learned to like it. So those are the two pet ones I've really got great knowledge on. And a couple of my patients do seeing eye dogs, and they've used it on their dogs with injuries. And my daughter has used it on our dog. We didn't take pictures. Our dog on his nose. He puts his nose under the fence and it always gets sore. She puts it on there and it gets better. So that's really been helpful. We really believe in photobiomodulation therapy. My husband uses it like on the hat. He doesn't have a hat, but he uses it on his head for various anxiety and PTSD. My daughter has done it, concussions. She puts it on her head. They've all gotten relief from this. We've seen amazing results. That's all.
Yeah, and when you mention about PTSD, or concussions, I'm in Florida. For those that didn't catch the beginning, in Florida taking a vacation, but it's been more of a work vacation. I've almost presented I'm pretty sure it's been every day right now that we've had the opportunity to use the light. As a matter of fact, one of the chiropractic clinics we went to, we ended up treating the incoming patients as they were coming in. The doctor asked me to do that, and one of them that was specially brought in was a young boy. Anyways, he had just 3 days earlier had a pretty significant concussion. He didn't have a brain bleed, but pretty significant concussion where he was actually blanked out for quite a period of time. And he said since it happened, balance and a few other things were affected. And also he says I couldn't think clearly.
Yeah.
And so we did one treatment on with the helmet, and he says, and it was not even 4 minutes. 4 minutes was the treatment. Already at 3 minutes, he says, I don't know what it's doing, but I can think clearly. And by the end of the thing, he took the helmet, 4 minutes, and took the helmet off and said, wow, I am very surprised. He had,
that was quick.
yeah. So we're having trouble trying to share that picture, unfortunately, but that would have told the tale.
It would have told the tale. Yeah. The whole tail was bandaged and it was all red, irritated. We had pictures, but somehow we haven't kept them in the past year. There was no hair on the tail. It was sore. They were going to cut the tail off. And they didn't. She said, no, let's try this. And then she had me my machine, and he's got his tail still and he doesn't have any more problems. So that's huge. And I don't know, do you want me to, the bone? Oh, the bone was exposed. I forgot the bone was exposed. She gave me notes. And they did everything the vet said and it still didn't help. And 2 weeks of this every other day, and it's done for now a year at least. It's been a long time since we got yours. We got yours during COVID. So yeah.
Yes. Yeah. And then you bought the first couple, and then you bought more, and then you bought more.
Many of my patients own them now. And I was hoping one of them is a dog person, but nobody wanted to give you a video. I'm sorry. But yeah, I've heard good stories. They've helped their knees. I put it on people when they're in the chair and they can just stick it on wherever body part they want. And so they put it on their knees, their elbows.
And you told me about the ear. If you want to share about the tinnitus.
Yes, you can put it on the ear and it can help tinnitus.
We've seen the same thing. We've seen the same thing.
The tinnitus is going crazy after COVID. People are getting tinnitus pretty badly. And it is, if you do it early enough, it seems to stop that nerve degeneration.
Yeah. And I've had right now, I have 9 people out of 12 who've seen significant improvement in their tinnitus. And that's pretty neat.
That's huge. And we just do it during the office when they remind us to, I can't get everybody to remind me I'm doing teeth, but I do let them use your unit whenever they request it or whenever I remember to pull it out.
Right.
Yeah.
I do want to say that to everybody to think of questions for Dr. Duke. Maybe not necessarily about your family pet, but we have a very knowledgeable dentist here who knows about PBM and could probably answer some of your questions out there. So remember about that. Right now, Dr. Duke, I'm going to ask you if you can turn off your video and audio, and we're going to go over to another person here.
I have a dog. His name is Manolo, and Manolo was, he had a happy tail syndrome, which he injured the tip of his tail, and we tried different medications like topical. We took him to the vet. He gave him an anti-inflammatory injection. Didn't work till I started using the SPP. And it took about 2 weeks, and I did it every other day, and it helped so much. And we noticed it like the first week of treatment with the SunPowerLED, and now he's all healed, it's all better. And before it took 3 months with the bed and medications, and with the laser, it just took two weeks for us to see the big change on the tail.
Wonderful.
Yeah.
Okay, excellent. So now what we're going to do is, Jim, if you, just after Brad, if we can have the video, the first video there of the opening video. And right now we're going to bring Brad Little on. Brad, there we go.
Evening, Tom, and everybody.
I'm in Florida on the ground, and Brad is in the air. No.
Can you hear me okay?
Yes, we can. Yes,
Wonderful.
we can. So tell us your story that you're aware of.
Yeah, and it's not a direct story in that it didn't happen to one of our dogs. We have 3 little dogs, but it is another tale of the tail in some ways. We walk a couple of our dogs around the neighborhood, and there's another couple, or a couple who walk their little dog, about 8-year-old Shih Tzu, by the name of Bailey, a very friendly little dog. And about 3 weeks ago, it was attacked by a German Shepherd, and fortunately, it wasn't really a vicious attack, but Bailey had his winter coat on still, and the vet said if he didn't have it on, he probably would have been dead. So it was a bad enough attack, and Bailey was cut, traumatized. There was nerve damage. He lost bowel movement, and he couldn't lift or wag his tail. And he also cried out when he pooped afterwards, and he had to squat to pee. And so it was pretty severe. And the plan was to send him to a veterinary neurologist. And so we found out about that, the same day or maybe the day after about it. And we immediately lent the couple our Super Palm 1050 for Bailey. And he'd been using it, 2 or 3 times a day, 20 minutes or whatever. We don't know exactly. And on the first day after the injury, Bailey, he's feeling sorry for himself apparently, and would stop at all the houses he knew to get petted, and so people could sympathize with him. And he doesn't do that anymore. He realizes he's better. But one day after the treatment started, there was some tail movement, and within a couple of days after the treatment, Bailey was walking much better and now walks normal. And 3 days after the treatment, his owner said he could lift his tail up much higher, and the tail is now 90% better, and there might be some permanent damage, but he's basically back to being his old self, and with hopefully very little permanent damage. And we can't prove anything, but we are fully believe that it's due to the light that he's recovered this well and this quickly.
Well, that's pretty neat. And Brad, what do you do for a living?
Oh, I work for this really cool, excellent company. I think it's called SunPowerLED.
No, but Brad has been that's true. But Brad has been extremely helpful. I have a number of patents. Brad is a patent writer, and he's been extremely helpful in helping me to get patents for the light technology in different forms. And so thank you, Brad, for your work and
My pleasure.
Your help and what you do. It's great stuff.
Thank you. It's easy to do when you really believe in something like this. So it makes it very easy and rewarding.
Well, thank you, Brad, for coming on.
My pleasure.
Appreciate that. And Jim, if we can go to that, the tail of the picture, the tail of the dog. There we go. If you can share that. There we go. Oh, wow. Pretty taped up there. So that was the story that was earlier about the trouble with the tail and how it healed up. So thank you, Jim, for popping that up here. All right. So just going back to the story, the dog, Big Lab, this goes back to my older technology that I developed before the SunPowerLED. I've actually been involved with PBM now for 15 years. I think it's now getting on to 16 years. Time does move on. But I would say probably about 14 years ago, something like that, one of the dogs in wintertime in Canada scooted across, took off across the ice on a pond and managed to build up speed to chase after a squirrel. But some of you might know that labs sometimes aren't the most brilliant. And so when he realized that he needed to stop, he couldn't stop and flew against the far side, the edge of the pond, and really hurt his backside on the edge of the pond where the dirt was. And well, they took the dog to the vet. There was nothing they said they could do at the time, but he had done some internal injury and some other stuff. And so they had to, in order for them to go up the stairs, their house was such that they'd have to go upstairs with the dog. The dog could use the front legs going up the stairs, but could not use the back end. It was seriously hurt. So they used the light therapy, but they were considering even putting the animal down, the pet down, because it was pretty injured by that event. But they thought they would give the light technology a try, and they did. And that dog recovered, was able to then jump in the back of the pickup truck once again and go up the stairs without any issues and chase squirrels all over the place again. So full recovery for that Big Lab with light technology. So at this point, what I'd like, Jim, if you could play the video of our the generalized PBM video, just to tell a little bit about our technology.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, you can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
And now I want to talk a little bit about the light technology. Now, being in Florida here, I do not have the helmet to show you, but you saw that in the video. And also, I do not have the mini canopy anymore because that's also been sold to another chiropractor while I was down here. So they love our technology, and it's pretty exciting to see how we can help so many people with that kind of technology. So the one individual who had at the chiropractic clinic who was coming in, the doctor asked me if I wouldn't mind treating this woman. She had scoliosis of the spine, really bad, looking at rods, in continuous pain. And we were able to use the larger mini canopy and do it on her back. And she's also studied to be a chiropractor in her early days, but couldn't follow through to the end due to some mental issues, but that prevented her from finishing. But she fully understood the body very well, and she hasn't been able to really have anything to give her relief. Well, we used the mini canopy on her back for 2 locations, about 20 minutes in total, and she was like significant reduction in pain, back pain, from the use of that device, from that treatment. So it's possible to even see relief in even the first treatment. But sometimes it's going to be something that's going to take a week, 2 weeks. And in some cases, depending on your age, it may be something that you're going to have to use for the rest of your life to avoid taking pills. And unlike pills that have side effects and long term could be damaging to your liver or damaging to other organs, light therapy is extremely safe. So we have, this is our palm device here. It fits in your palm. It has a special air system in here that keeps this cool so that we can have the amount of energy that we have coming out of it. So right now, this is the 660 nanometer, and you can see it going right through the palm of my hand here. And we also have on this one, this is our professional. It has the 810 nanometer, which I can look at, I can see, you can see. And it's extremely safe, unlike lasers, because of the diffusion coming away from the light is not a point source that can hit with high power on the back of the retina, but is very diffused. So people have actually treated their sinuses, and they've actually, in certain conditions, with their eyes closed, have been able to help the wellness of their eyes for different things. So with the eyes closed, it would be just a very short treatment of 1 minute of the one wavelength, 1 minute of the other. with the eyes closed. And we actually have the same power level that's coming from the sun, actually a bit more than that. But you know, it's very safe. I mean, in Florida here, they don't have signs posted, "Do not sunbathe," and because you'll damage your eyes. No, when you close your eyelids, it diffuses the light, and the light coming from the sun won't damage your eyes. Neither will the light from our devices. But lasers, you absolutely must use safety glasses. Okay. That was the Palm Professional, and then we have the next one up, which is the this is the Ultimate, which has 25% more power for both the 810 nanometer and the 660 nanometer. So it's same as the Professional, only 25% more power. So you can look on the SunPowerLED website, and you can see the specifications for this. This device here is our Super Palm that was mentioned by Dr. Duke, and it has the same power as our Ultimate for the 660, but it has, instead of the 810 nanometer, it has 1050. Now, when I look at this device and I look at it, I only see one little red light, oops, right over there in that corner. But when this camera is actually picking up the 1050 nanometer, and you can actually see it coming through, but to me, it's totally invisible. I can't see it at all. So 1050 nanometer has the possibility to penetrate a little deeper. And that's why we developed this light. The LEDs cost more, so it's a more premium product. You're looking at $1,900 for the Super Palm. Okay, so that's my little commercial. And now what I'd like to do is ask everyone who wants to send us the questions. We'll try and answer a few of those questions. So let me look to the questions. Oh, I wanted to mention too that I just spoke to a fellow from Sweden who's with horses, and that was just about 2 hours ago. And he's extremely pleased because one of his horses had a number of areas that were very painful to the horse. He was able to, like, if he would palpate that area, the horse would be in pain. So that was, he was able to help this horse get rid of all these pain areas that he was able to do that with using the 1050 nanometer on the horse, even though the injuries were actually deeper in the horse's muscle tissue. It was able to reach into that tissue and help that. So that was pretty neat to see. So now I'm going to start answering some of the questions here. Let me just go to the right place here. Oh, sorry, I've got a message here. Dr. Duke cannot stay, so I'll have to answer the questions. That's fine. Okay, so go ahead and ask your questions. Let's see. Okay, so just in clarity, the 660 has the ability to not penetrate as deep as 810 or 1050, but it has a tremendous influence on the blood in the area. So that is really important because that helps with blood flow as well as lymphatic drainage. Okay, so whereas the 810 or the 1050 is the one that you want to use to reach the joint. So if you're talking on with humans or animals, the 1050 has no problem to reach the deeper area of the treatment area that you're trying to reach. So people have actually used it on their for sciatic hip pain, which means the light has to get to the okay. So I've got sorry, I'm just wondering, Dr. Duke, if you're still there, if by chance there's a question that just came up here, if you still are on for some reason, join us. There is a specific question. Okay, so the question was from Beth, and she wanted to ask Dr. Duke about using the PBM for an infection. And so, as a matter of fact, Beth, if you want to call me after the program is over here, the webinar, I can get into that a little deeper with you, because I've seen there's one of the women, she had severe infection in through her jaw that she had been on antibiotics for a long period of time, and the jaw continued to be dissolved. She had a large section of her jaw that was significantly impacted by this infection. And anyways, she has been able to totally clean that up. One of the fellows from my church, he's a senior, he'd be close to 90. And for a major part of his life, something like 60 years, he's had infection one after another in the ear area. And they've cut out sections of bone around his ear. And he had this infection going on for a very long time, 60 years. And he started using the light. And within 2 weeks, that area drained and healed of the infection, and he had no more pain after all that time. So how long would you recommend using the 810? This is from Deborah, I believe. How long would you recommend using 810 on my dog for hip pain? He's 11 years old, 80 pounds. I think you'd be looking at between 5 and 10 minutes. That would be probably a good time frame. And I would use about 3/4 of the time definitely being on the 810 wavelength, or if others have the 1050 to treat a large dog, 11 years old, 80 pounds. I think in the 5 to 10 minute region range, you'd be really helping your animal. Now, I would say about 1/4 of the time you would use the red, because the red helps the blood flow through the area. Now, if you find that the red is heating up the fur a little bit too much, and it's possible, depending on the density of the fur and the darkness, then shorten the red period. But I would as well, I would also as well suggest that you start treating 2 or even 3 times a day for that, to try and help that. Okay. There's another question that came in from, unfortunately, with my browser here, it's cutting off the name. I'm going to see if I can change that. There we go, Geraldine. I wanted to ask Dr. Duke how she would use PBM on fistulated dental abscesses. I'm not sure what she would have said, but I have been able to see a few people be able to see that improve the situation to the point where they didn't require a root canal. Okay, and Jonine is asking, do you think the light has any effect on seasonal affective disorder? Well, we know one thing is that red light is in the evening is something that is desired. You want to try and block blue light. So there are filters you can put on your phone or on your computer so that you don't see, or if you do, it's very, very low intensity blue. that you gets through, or you can wear glasses to do that. And I actually know somebody who runs their red light device, and they found that they can far easier fall asleep in the evening. But with SAD, one of the things that's really, really important, and I don't sell any equipment for that, but if one takes a very, very bright, cool white, that's one of those ones that looks very bluish, and you turn it on first thing in the morning for like 10 minutes, sit in front of it as soon as you get out of bed. That can help establish your circadian rhythm. So it's extremely important to get that first burst of very bright blue light. So it's as easy as putting a 100-watt light bulb a foot away from your face, or a foot and a half away from your face. You still can do what you're doing, maybe on the computer or whatever, but that exposure first thing in the morning sets your circadian rhythm, or the clock of the body. And as long as you stay away from blue in the evening hours, that'll be very helpful. So does this work on lymphomas on the skin on my dog? I can't comment to that, I'm not sure, but it does help with the lymphatic drainage. So this may be something that could be beneficial, Deborah, to your dog. Thank you everyone for your questions here. Very good questions. Okay. Is the dental probe attachment necessary to treat intraorally? A person can use the light to treat from external. It's possible. Does take longer because it has to go through the thickness of the cheek. But obviously when you use the intraoral probe, you're able to direct the light right on the surface. So if it's a small area that you're dealing with, the intraoral probe works really great. If you have a whole area of your mouth that you got to treat with, it's better than to use the larger light, like the palm device, and treat it. And some have actually, if they have sores on their lip or inside their mouth and it's exposed, they can just open their mouth and allow that to happen. Fran is asking, you mentioned about using the light around the eyes. If you have implants, would there be any adverse effect? No, people have had metal in their body, screws, rods, plates. It does not have any effect on that. As a matter of fact, they have found that there's a study that's out there that shows how the light can actually improve when an implant is done, to improve the bone growth around the implant, to make it happen faster. Okay, another question here is from Jodine. When Dr. Duke was describing the older lady with trauma to the face and teeth, was it likely that Dr. Duke used the light while the mouth guard was in place? In other words, was the light able to penetrate the mouth guard? I've seen mouth guards that are clear, and so there wouldn't be a problem with using, even if it's a milky white, as long as it's translucent and the light can go through, no problem. It will, yeah. So just want to also remind people that I'm not a medical doctor. I've just worked with a lot of medical doctors and dentists and chiropractors, and I'm just sharing with you some of the knowledge that they've been able to share with me, and also people that have come and used our light technology and how they benefited. Tom Davis is asking, can the palm light be used to treat or reduce high blood pressure? I cannot comment to that. I do not know. I do not have any experience as far as the effects with blood pressure, whether it's on the heart or whether it's some other issue. I don't know. Okay, I understand PBM. This is from Geraldine. Understand PBM is very beneficial in cases of mucositis. How is it used, with or without the probe? It seems the probe would be too small to address the entire, and I think I answered that question as far as you can use the, you're just going to spend a little more time using the device from the outside, but it'll go through the whole area. So no problem that way of getting through the cheek. It's just going to take some time. So this may be something that you're going to spend 5-10 minutes on an area. If you have the time, mostly I would suggest the near infrared, again with a little bit of red, because you're trying to treat deeper, but most of the time would be the near infrared to go through the cheek and reach the inside areas of the jaw and other areas. Okay. Okay, so Deborah, we're suggesting you're asking about how can I find out about all the uses. We are going to bring together a video that will help with describing some of the uses as more people give us information. So that's what our hopes are. But anyways, so thank you for your nice comment. There's so many uses I'm not aware of. This is awesome. Yeah, it was pretty neat technology. Okay, with mucositis, if the palm is used with an open mouth or how? Well, mucositis, as I said, through the cheek can be used. Or if you're it can use the intraoral probe and treat inside that way. I just think it depends on how much area you're talking, where the problems are. But it's much easier just to take time and treat across, right through the cheek material. Okay, question came in, can the classic be used for stopping gums from bleeding? Yeah, it can. It's just going to take some time. Yeah, so anytime light can go into the area, it can help improve in the situation, whether it's bleeding or other. You're helping the mouth to heal. And I do recommend that there's I do recommend on our website, SunPowerLED.com, going under the area of the tab under research, and you'll find that there's a whole area of where you can click on and find out about research studies that are out there. And there's 7,700 research studies on that we're linked to on our website through this one link. So please go there. And you'll find lots and lots of good information if you're trying to do research. Another question from Geraldine, are you aware of any research on the effects on cataracts? And I gotta say, no, I'm not aware of work done with cataracts. I do know that studies have been done with light for wet macular degeneration, and light has actually been approved. Not my light, but a specialized light that's used in an optometrist's office in Europe for wet macular degeneration. So yeah, so all right. Well, I think we've come to the end of our webinar, and thank you for all those that have forwarded us questions. If you felt for some reason I missed your question, please send the question to info@sunpowerled.com. That's info@sunpowerled.com. And there's all sorts of good information. If you have a certain other questions, please go ahead and send us an email. We'll be glad to try and answer those questions. Thank you, everyone, for coming on tonight, and we'll see you again next week, Tuesday. We're working on the topic, and we always love suggestions. So if there's suggestions out there, please forward them to us. So thank you for joining us tonight. All the best, everyone. God bless you. Bye for now.